time, we may not be able to take people speaking or asking their questions directly, but we can take questions and comments from the Q&A section or from the chat room. Thank you. Over to you.
Thank you, Ma. Thank you very much, Ma. Questions here, and then we will share with okay. Oh, this is a comment, not a question. So please, we would appreciate any questions. We have Dr. Enaro here. We also have Dr. Adetutu still here. Okay, someone says for Dr. Enaro, can I easily identify and name my emotions? Dr. Enaro, sir, we have a question for you here. Yes, sir.
Yes. Said,
thank you, sir.
Can I easily identify and name my emotion? Hi, Tony. Just where you are right now, can you tell me the emotion you're feeling? Just right now, what emotion are you feeling? Is she here?
All right, sir. I'm happy at the moment.
You are happy. Can you
Yes,
tell me the
please.
last time you felt angry?
Mm,
Can you remember?
Today, yeah, maybe yesterday.
Can you remember the last time you felt fear?
I felt what?
Fear, anxiety or fear.
Not really, but I know I've had fear before.
Or apprehensive. Just some. All right. Can you remember the last time you felt surprised?
Surprised. Okay.
You got
Like
a
3
flower?
days ago.
Hmm?
Like
You got
3
a
days
flower?
ago, sir.
Yeah, I said you got a flower or alert?
An alarm.
Alert. Great.
Yes, sir.
Can you remember the last time you felt irritated? You saw something you don't
Mm,
like and felt irritated. Yeah? Can you remember?
I don't really remember that.
Okay.
Can't really place a date on that.
Okay. So what we're doing presently is we're just naming our emotions. We're identifying our emotions. I took you back. You identified some emotion in the past. And presently, I might not be sure of the thoughts that you're feeling that's making you happy, but you're happy. So that's how easy it is to identify our emotions. The challenge is when we have amygdala hijack. What that means is when our amygdala, when our thalamus in the brain, something in the brain feels a form of threat, maybe somebody disrespects you or somebody does something that you don't like, that you've warned them not to do, the thalamus interprets it as threat. When the thalamus in your brain suspect that there's a threat, it shuts down the cortex part of the brain, which is how you think, and it takes you straight to the amygdala. So at that time, you are not thinking, you're just acting. When you practice emotional intelligence, you're able to tell your thalamus, this is not a life threat, it's just a felt threat. Those are the things that stops us from being able to focus on what am I feeling. And the question you ask is the beginning of emotional intelligence. Everybody must be able to say to themselves in the middle of a situation, what am I feeling? If you can't ask yourself that, if you don't practice asking yourself that question in the middle of a situation, practicing emotional intelligence will be difficult. It's a beautiful thing to always ask yourself, what am I feeling? You see, those days you sit down in the kitchen when you're cooking and you start doing nonsense, rubbish. And any child that strolls into the kitchen at that time, if that child is not be careful, his backhand that the child will get. Those times, what is happening to you at that time is there's a thought going on, there's a feeling going on, but you are not aware. So what you're supposed to do is to stop and say, what am I feeling? I feel angry, and that's okay. I feel irritated. I feel sad. I feel anxiety. It's all okay. You know why it's okay? Nobody can see the feeling. Nobody can touch the feeling. The feeling does not have a shape. It's only happening inside of you. The challenge is usually, what am I going to do now that I feel this emotion. And there's a difference between the feeling and an action. There's a big space inside of it. The feeling is not your action. Anger does not equate yelling. Anger is a feeling. Yelling is an action. There are several things you can do while you are angry. But the beautiful thing would be to first know that, I am angry. Because 5 people can be angry and do 5 different things. Some will be good, some will not be good. You don't regret because you feel emotion. You regret because you take an action that is not appropriate for the situation. So, Tony, you've just practiced identifying your emotion. It is that simple. For bigger emotions, just take a pause, chill, calm down. Ask yourself, what am I feeling? Thank you.
Thank you. Thank you, Dr. Enari. Thank you so much, sir. Thank you for honoring our invitation. If we have any other question for Dr. Enari, we take one more question, but I'll quickly take a question that we have here for Dr. Folakemi. It says, how can women effectively balance financial responsibilities, career growth, personal well-being, and external obligations, such as family expectations or black tax, without experiencing burnout in the economic condition as though in Nigeria, especially as the first child of the family? Dr. Falakemi, over to you, ma.
I am smiling because that is a very popular question. And the question usually has a part that says, especially in Nigeria. Always, always. If I get asked that question 10 times, 10 out of 10 times, it will have a part that says, especially in Nigeria. So it starts with a decision. Number one, you cannot pay everybody. Even as a first child, you cannot pay everybody's bills. You cannot meet everybody's needs. You need to make up your mind. You need to first settle that in your heart and then make up your mind that you want to be financially stable. Now, one of the things I always tell people is that if it was easy, everybody would do it and everybody would be rich. Everybody cannot do it because it is not easy. So are you going to feel pain at the point when you decide I want to achieve financial stability? Yes, you will feel pain because you're going to have to cut down on some expenses. You're going to have to say no to people that you dearly care about. You're going to have to rearrange your schedule, in terms of also scheduling your time appropriately, because it's your time that you exchange for money. I hope you know that. All the 8 hours, 9 hours that you spend at work, you're exchanging your time for money. You're going to, adjust. A lot of adjustments will have to happen. So is it going to be easy? No, you're going to feel pain. Yeah. But then, is it possible? Can it be done? Yes, it can be done. I think the first step in the right direction is making up your mind that this is what you want and you deserve it. You deserve to have financial stability. You deserve to have to experience financial well-being, right? And then, like you rightly said, download that tool that I spoke about, Digital Financial Freedom, DFF. Download it. It will help you to start monitoring your expenses and start noticing the things that you're overspending on, the boundaries that you need to put in place. You can have a budget for yourself and tell yourself, okay, out of this money, the amount that I have to give to anybody is XYZ. Once that amount is finished in a particular month, everybody else needs to wait till the next month. Guess what? Nobody will die. I assure you. Especially when you have put proper buffers in place, like healthcare, insurance, and all of those things. It means if somebody falls ill, you simply call on your HMO. If an emergency happens, you have all of those things in place, right? Nobody will die. And I've tried it with people before, some of my coaches, where, one of them happened to be someone that was living with me, a young adult. And I realized that she was always spending all of her money. She said, no, it's because my brother would call my family. So one day I told her, you know what? I'm going to be showing you your money, but I'm not going to transfer it to you for just a few months. And we tried that. And I told her, anything you need to spend, I will give you a gift, a financial gift. You spend that, and then you will keep your money. And then after a few months, I transferred all her money to her, hundreds of thousands of naira. She was so excited. So I asked her, in the process, while you were doing this, and you were spending only what I gave you, did anybody die? No. So all those people that cry, if you don't give me my rent, they're going to throw me out. They will find a way because they're adults too, right? So please prioritize your financial well-being. Please do. I hope that answers your question, or at least gives you some guidelines on how to do this. Over to you.
Thank you. Thank you. Thank you, DFF. Thank you, Ma. Thank you so much for that. I believe that we have one question for Dr. Adit to just a minute. I just saw the question now, but I can't see it again. Okay, okay, I've seen it. Okay, so to Dr. Adetutu, what can I do to manage my mental health as a mother, wife, and working not to lose it? I think it's a mother and a wife saying that she doesn't want to lose it, and how does she manage her health, her mental health? Over to you, Ma.
Yeah, thank you so much for that question. So I like to talk about some tips for mental well-being and how to balance your life really in terms of balancing your work-life balance, something like that. I think I use the float strategy. So F is for focusing on boundaries. So you focus on your boundaries. And so no is a full sentence. Everyone on this call today could practice the fact that I can say no to you and nothing is going to happen. The world is not going to come to an end. That's number one. I'll go on to talk about L, which is leveraging on your support systems. So at work, you've got support systems. If you're a manager, you've got people you can delegate to. If you're even at home, you can find a way to delegate. These days, we have couples who are able to help each other out a little bit and make things a bit more comfortable. So yes, leverage on your support systems, family, all that stuff. I would say O is for organizing and prioritizing. So think about it this way. If there's something that you can tackle in 2 minutes, that is a task you should do immediately. If it's going to take much longer and a lot more brain power and all that stuff, I think you should probably prioritize it. If it's very important, then you can go ahead and do it. If it's something that can wait, you should be able to push it backward. I'd also say that part of organizing your day is not checking your emails frequently. You should have a moment to check your emails, maybe in the morning and another one in the afternoon, not refreshing every few minutes so that you can continue to add to your to-do list. I would say A is for allowing time for self-care. So even just once a month, can you take a few hours out to yourself as a mother, as a wife, as whatever? Go, I mean, whatever you can afford, even if it's just manicure, pedicure, something that relaxes you. Just go out to the park. No parks in Nigeria. Go out somewhere and relax yourself. Just be on your own. Take yourself out to lunch or something that refreshes you. Watch a movie. And the last thing would be taking breaks. So we like to think about it this way. If you work for about 52 minutes, can you take a break of about 18 minutes stretch? It helps you to be more productive. So the float strategy, that's what I'll advise you. Thank you.
Thank you, Dr. Adetutu. Thank you so much. You have another question here, and I'll just quickly read it. Seeking help for mental health is stigmatized in this part of the world. How can we encourage people to get help, even where there is mental health help desk subscription? Nobody calls when they are breaking down.
Yeah, I completely agree. I was speaking with Dr. Folakemi Fadausi yesterday, and I said, this is part of the reasons why I started a company in mental health, because I realized that, it's not even that accessible. Even if you had the help there, it's not even that accessible. People have to think the stigma is so high. Everyone thinks that once you hear mental health issues, that person is roaming around the streets naked. And it's not even like that at all. I think a huge part of it is stigma in Nigeria. And I think um, programs like this help to tackle that issue. We continue to integrate mental health discussions into regular physical health discussions. This is how we're beginning to break the stigma. I mean, the other day I was granting an interview to a TV station and I explained to them, say, listen, it is an epidemic. People are going to have mental health struggles. In fact, the statistics shows that 1 in 4 people are going to suffer with one kind of mental health struggle or the other in their lifetime. So begin to regularize this. Begin to understand that this is not a weakness. It's not, I mean, you don't blame yourself for having high blood pressure, for instance. This is exactly the same thing. There are people that are predisposed to having this kind of conditions. being aware of this is key, because imagine that someone has got a predisposition and they're not even trying to take the necessary steps when things begin to go wrong. Pregnant women, we don't encourage them, when they have issues, postnatal depression, psychosis, everybody's like, there's a name they call it, abisinwi, something like that. We need to become more educated around this, and that's why every program that is that is health related, please let's push mental health forward. That's why I was so happy to come onto this program, so I can help enlighten people. Yeah.
You're muted, Oyin.
Oh, apologies. I thought I was speaking. Thank you, Dr. Adetutu. Thank you so much for that answer. I have two more questions here, and it's directed to Dr. Olumide. So, Dr. Olumide, question here is, does Aspire HMO plans covers preventive healthcare and assessment? And the second one says, how can I register with Aspire HMO? Can I register as an individual? So that's your question, sir.
Okay, thank you very much, Oyin. Yes, so we do have packages that have some of these screenings embedded. We cover mammograms, we cover the routine basic checks that you need. We talked about full blood counts, we talked about lipid profiles, we talked about there are some other tests that you need to do to chest x-rays. So some of these plans, some of these tests rather, are covered on the scheme already. And then we can also have separate plans for you if you desire to go do a more thorough screening, as it were. But yes, in summary, we cover we cover this screening tests and these preventive strategies. For onboarding, we have a process. So there is an onboarding team. We have retail plans also, specifically for different age groups you have. So if you want to get a plan for an elderly person, something we can do. If you want to get a plan for yourself and your family, something we can also do. If you are also looking at getting a plan as an organization, we can also help with that. We have a contact person you can reach out to. I think we should put up the slide. So you can just always send us an email, drop your number in the chat box. We'll reach out to you, and we can always take the conversation forward from there. Yeah.
Thank you, Dr. Olumide. Thank you, thank you, thank you. And lastly, our question is the question here is going to Dr. Enar. Says is there a medical assessment I can do to better understand and manage my emotions?
Yeah, so there are a lot of medical assessment. I leave that to Dr. Adetutu. However, Dr. Adetutu, are you a medical doctor or our type of doctor?
I am a medical doctor and a
Great.
psychiatrist.
Great. So that question will go to her. Yes, there are a lot of assessment that can be done. What we found out, however, is in working with medical doctors, we see that it is possible for you to take an assessment to be under treatment of some mental states. I just keep it safe like that. But then you still have to learn to practice the things that we're teaching here. So if you ever feel like you need to take an assessment because of your emotional state or mental state, please reach out to a doctor, a medical doctor, immediately. Even if you come to me and I have a discussion with you as a life coach and a therapist, there are certain indicators that I will see, and I will say you need to see a medical doctor, right? So I think that answers the question. Thank you.
Thank you, Dr. Naro. Thank you. I believe that these sessions have been very impactful. Thank you, Dr. Naro, Dr. Falakemi, Dr. Adetutu, and Dr. Olumide. And thank you, everyone who has stayed with us from the beginning till now. I will just quickly, hand over to Dr. Falakemi so that we would wrap it all up. Thank you.
Hey, thank you, everyone. We can't say it enough. Aspire HMO is an health maintenance organization, like you already know, and this is our first outing hosting this kind of webinar and health talk, and we feel very honored that you made our time to be here. So we're very grateful for that, and which is why we're very excited to give out a lot of freebies, including the app I spoke about, the assessments that Dr. Adetutu spoke about, and of course we're looking to also partner with our doctors on the call, Dr. Adetutu, Dr. Enaoro, to see how we can give a holistic, some holistic healthcare plans, make them available to people and is easily accessible. And I think that would further reduce the kind of stigma that people sometimes attach to, just by themselves, walking into a psychiatrist's office to seek for mental health care, right? If it is bundled into the plan, then it makes it even more accessible. So we're going to be doing that. And I want to also share our Aspire HMO contact details. If you can please put that on the screen, Jeremiah or Oyin, so that everyone can have the details. We'll also share more information on how you can access some of these plans. And we thank you very much for coming. Thank you, Dr. Adetutu Kunuji. That has been it's been a fantastic experience just listening to you. Thank you, Dr. Enauro. Thank you, Dr. Olumide, and thank you, Oyin, for being a fantastic moderator of this session. Our details are on the screen. Please feel free to take a screenshot, reach out to us, follow us on Facebook, on Instagram, on LinkedIn, and you can see some of our plans on our website as well. And please feel free to follow me as well. Feel free to follow Dr. Adetutu Kunuji and Dr. Enauro Okai. Thank you very much. Have a fantastic rest of the day. Bye for
Thank
now.
you for the invite.
Bye.
Congratulations once again. Bye, everyone.
Thank you. Bye.
Thank you. The contact information is also in the chat room. Please, you can take the number and reach out to us. Thank you very much, everyone. Have a great day. Bye, everyone.